afternoon, everyone. Myself, Dr. Kirti, Assistant Professor, Physiotherapy Department. So today we'll discuss about Piriformis syndrome. So it is essentially the compression of proximal sciatic nerve, resulting in neuritis and pain. It is a condition in which piriformis muscle become tight or spasm, or we can say irritates the sciatic nerve. So in majority of human, it originates from anterolateral portion of the sacrum and inserts at the proximal femur. The nerve crosses under the piriformis at its origin. The anatomy is the T1 weighted axial MRI at the level of proximal sacrum. So we can see here is the sacrum, sciatic nerve, and piriformis muscle. Next, patient complain of unilateral gluteal pain, which can or cannot radiate down the leg. We have paresthesia in the sciatic nerve and branch distribution, which can worse with the walk or run, and sometimes it is difficult to locate the pain even. Most often it is described by the runners, and it can occur after the long sitting also. Usually the pain is in the buttock region, and it could be the referred pain from hip, but low back area or thigh, and there is a deep pain in the buttocks, so it is all that's what is known as the piriformis syndrome or deep buttock syndrome. So on physical examination, you have deep pain on palpation affecting the gluteal muscle, and sometimes SLI is positive also. So there is a BT's maneuver, like patient is placed on a non-affected side, and then the affected leg is bent at knee and abducted against resistance, which can reproduce the patient pain. And also pain is also elicited on hip flexion, adduction, and internal rotation. Then what causes piriformis syndrome? It is caused by shortening or tightening of the piriformis muscle, and usually it is attributed so many things are attributed to this, but mainly it is caused by two things: overload or biomechanical inefficiencies. Overload or training errors, like exercise on hard surface, on uneven ground, or high intensity or more duration, or ill-fitting shoes, or sitting for long period of time. Biomechanical inefficiencies contributing are faulty foot and body mechanics or gait disturbance, poor posture or sitting habits, poor walking, running, there could be tight muscle, and there is also some anatomical variation in the muscle. Like some are having upper belly insertion or proximally, or lower belly insertion proximally. Some have both bellies fusion. So there are individual to individual variations. In this figure also there are some anatomical variants shown. Women are 6 times more likely to get piriformis syndrome as compared to men. It could be due to greater Q angle, or they uh, place more stretch on the piriformis, leading to great rate of inflammation. And women often complain of dyspareunia with this. If the Q angle theory is correct, then aggravation would be due to abduction, external rotation at the hip joint during coitus also. So isn't this just sciatica? So yes, sciatica is a catch-all term used to describe any pain syndrome with symptoms and distribution of sciatic nerve. But it's very important to differentiate it, the sciatica from piriformis syndrome, because the treatment is different for both. For even we can say MRI spine or CT, there are some anatomical variants show CT show inflammation. Sometimes NCVs are done to assess the sciatic nerve conduction. Sometimes Botox is also taken by the patient, which is the latest trend. We can say how we can prevent. So there are so many preventive techniques which help in preventing this syndrome, like modify the equipment or sitting position. You should take rest, and are learning new routines for repetitive activities. So first we can do correct warm up is very important to prepare the muscle and tendon for any activity. Second, rest and recovery are extremely important, especially for athletes. Third, strengthening and muscle conditioning, like low back muscle, buttock muscle, or hip muscle. And fourthly, flexible muscle and tendon are extremely important in prevention of strain and sprain injuries. For best result, runners and other athletes must know that warm up is extremely important. They should include stretching in their warm up and warm down, like runner stretch as shown in this figure also, or pigeon yoga's pigeon pose. That's the best therapy for this syndrome. And it's very important that they can take heating pads on the seat sometimes. Like then we are having the treatment. One can do glute stretch, piriformis stretch as shown in the figure, TFL stretch, calf stretch, psoas stretch, and then quadricep stretch. These are some of the references. Thank you.